So I heard that you're supposed to retire, but for all of us who know that that's what she's thinking to do, can we give her a round of applause to help her think she should not retire?
That is a hard act to follow. And let me just tell you, when she reaches way back, I mean, because we have known each other over the years. But I think one of the things that's very important is that when she acknowledges Jerry Adams, that she knows I'm in. Jerry was my mentor, and you know, nowadays we don't necessarily remember that it's all about holding your hand out and reaching out and bringing somebody forward. You know, each one, reach one, and teach one. And Jerry was just that kind of person. And she, when I started working for the County of Wayne, she said, "Come here, girl." And I went. She said, you have some obligations, you know, and these are what those obligations are. So, you know, Jerry, I think, lives in all of us in terms of the work that she did and the work that she continues to do. Again, have to echo what other people have said in terms of saying how excited I am to be here and to be part of the launch of Wayne Chap. I have to tell you that I'm excited on a couple of levels. The first one certainly is a professional level in terms of the work that I do at the Detroit Wayne County Community Health Agency. And so with that hat on, I certainly congratulate you on behalf of our board of directors, on behalf of Edith Killens, who is the Director of Health and Human Services for Wayne County, and certainly on behalf of Mr. Robert Ficano, who is the CEO of Wayne County. But also, I want to kind of just say a few names here. I mean, we've been struggling for a long time. I mean, a long time. Deborah Strong, we struggled at the state together and continue to struggle in the community together. That's an important thing. You know, folks have said that you have the obligation to bring in someone new, and you must be there for that person that you bring in and provide that support. So I have to recognize Carla for all the hard work that she does. How she works with me, I don't know. God bless her. And as you very well know, in this business, there is not an overabundance of males involved. So that's why we all love Chris. And, you know, we certainly are enamored by Jack that, you know, he takes up the flag and then throws down the gauntlet at the same time. So I want to also recognize Jason, who has joined our merry band. And a very special thank you to the Kresge Foundation and ECIC for the funding and whatnot. But I will also grab something out of my past as well, and that is to say a very special thank you to Dr. Teresa Holtrup. And I have to tell you, when I first heard about what was going on and Janetta was involved, and I thought, ooh, this is going to be really good. And then they said, well, guess who the doctor is? And they said, Dr. Holtrup. And I thought, okay, we got a home run. Let's go ahead. I'm telling you that this lady is amazing. Amazing. Not just in her professional capacity, but in her commitment and her spirit and her energy. A million years ago, I worked for the state of Michigan at the what was then called the Office of Substance Abuse Programs. And they brought me in and gave me this job that was actually it was the first time they actually created the position, and I took the job. And my job was to work with the substance abuse coordinating agencies to help them understand that women experience substance use disorder differently than men. And in addition to that, I also was charged with the responsibility of making people aware of the impact of substance use on unborn children. And so my title was woman specialist. You know, so being from maternal and child health, of course, I had to say children and families, I get all that in there as well. But, yeah, there's a lot of history in terms of understanding who people are. So I really want to congratulate everyone and just let you know how excited I am. I want to thank Carlin again, because one of the things that happens is that some days I go from meeting to meeting, and as I pass by somebody, they put paper in my hand and say, go do this, do that, do the other thing. So Carlin was kind enough, because she knows that I'm old, that's why I'm retired. And she put down some notes on a piece of paper for me, and my job is to try to translate that into some coherent exchange between us, and so I'm going to try to do that. One of the things that's important is, you know, as folk who are involved in community organizing, in healthcare, and other facets where we bring assistance to people, we're really into numbers and data and that kind of thing. And one of the things that Carlin put on here is that 21% of children and adolescents in the United States meet diagnostic criteria for mental health disorder with impaired functioning. 16% of children and adolescents in the United States have impaired mental health functioning and do not meet criteria for a disorder. 50% of adults in the United States with mental health disorders had symptoms by the time they were 14 years old. And so what we have is the opportunity to really integrate behavioral health, social services, the work that our foundations do, our faith-based organizations and other community organizations, to really look at providing the health home for children who have special health care needs. Now, the health home concept, I'm really excited about that. I'm excited about it on a few levels, because Chris talked about the work that we've done on the adult side. But on the children's side, one of the things that we have to do in mental health is continue to really push to make people understand that children are part of the mental health system in terms of their needs. And that one of the things that we don't do is identify them early enough. And so and that's for a whole lot of different reasons. But there is clearly some language that goes around, that wraps itself around the definition of children and youth with special health care needs. And those are children who are at risk or increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services as a type or amount beyond that's required by children generally. Those are the kids that we see. They come to us and they enter our system usually through an emergency situation, and we have had to try to put programs in place to be able to reach out earlier and intervene through services like infant mental health and the wraparound program and other activities that we do in mental health. But in doing this, we recognize that you just can't reach out and deal with a child. You can't pluck a child out of a family situation and say, I'm going to deal with this child, but I don't care what's going on with the family. I don't know if they have somewhere to live, or, you know, if they're living in Belle Isle, on Belle Isle in the car, and mom has the wherewithal to drive him to school every day, but she doesn't qualify for benefits to be able to get housing that she desperately needs. And so what we have to look at are what are the challenges that face the children that we work with on a daily basis, and understand that the children that we see are the same children that everybody else sees, because the children belong to all of us, and their needs transcend what we call systems. And so we, as the professionals and the adults and the peers and the folks who are involved and we care about what's going on with children and families, have to come together to be able to make a difference. Wayne Chap is an example of what we're saying in terms of that coming together. We have unfortunately shifted a lot of responsibility for the care for children to our schools. Now, I don't want you to misunderstand. I believe that it is at the beginning, when we start to receive children, that we begin to educate them and support them around learning that helps them understand why healthcare is important. And we provide certain programs for them to enrich their healthcare and to assist in terms of their actually being able to learn. But one of the things that has happened is that the funding that we need to be able to continue to do that is not the same funding that we had previously. It's been reduced considerably. So we have school systems who are struggling because they know how important the integration of healthcare and education and learning and all of that is to provide these services. We have families who want to be involved in the education of their children, but because of other stressors in their lives, they can't participate at the school level. So in terms of collaborating, it's going to be our responsibility to try to re-engage them and bring them in so that they can participate. And I think Wayne Chapp is going to be a perfect opportunity to do that. And as we, participate with them at the table in terms of moving the program forward. The other thing is that children with chronic medical conditions have more than 2 times the likelihood of having a mental health disorder. 2 times the likelihood. And so the goal of creating integrated programs, health programs, and mental health and school-based and those kinds of things is something that we really have to work at and strive to see that we have sufficient opportunity in our community. I want to point out also that there are some things that are kind of built in already. We already have the EPSDT program, which is the Early Periodic Screening, Diagnosis, and Treatment program. That program cuts across. It serves children from 0 to 21 years old. When a child goes into care or foster care, they're required to have an EPSDT screen. In our Wayne County Juvenile Detention Facility, they're required to have an EPSDT screen. What that says is a result of that screen, if anything needs to be treated or ameliorated, it can be covered using Medicaid funding. That's a link and an opportunity to be able to use a funding source to ensure that our children are getting 2 kinds of health care, the behavioral health or mental health side, because we are required to provide those services, as well as the physical health side. I just want to tell you also a little bit about the Mental Health Agency with regard to our work with children. We serve folks really from 0 until the grave. Literally, that's the population that we're responsible for serving. In fiscal year 9-10, we served 15,382 children. Of that number, 13,213 had serious emotional disturbance. So far, in fiscal year 10-11, we've served 11,187 children, 0 to 17 years old, and we have already identified 9,139 who have serious emotional disturbance. Now, we also serve, as I indicated, older kids. And so that population, which dovetails with what we're doing with Wayne Chapp, is for us in terms of data collection, 18 to 25-year-olds. In fiscal year 9-10, we served 8,459 kids. 13,000, again, had serious emotional disturbance. And so far, we're looking at serving 6,222 of that number. 9,139 have serious emotional disturbance. Now, the thing that makes that interesting is when you look at the target numbers that Wayne Chapp has identified, and you look at those kids who are in our system, who I've told you have serious emotional disturbance, Medicaid is a primary payer for the services that those kids receive. So what that says is there's already a marriage. It's not even about, us sitting at the table and saying we're going to work collaboratively. We already have identified the children. And we know that many of those children are children who have very special health care needs. So as we move on, we've done a lot of work in terms of working